for coming here to the Austin and what is a really exciting step in medical research and innovation, world-leading innovation here, which I'll talk about in a moment. So we have the Minister for Innovation, Medical Research and the Digital Economy, Jala Pulford, Anthony Carbines, who's the local member and also the Parliamentary Secretary for Health, and we've got Professor Sutton here as well, and the team from the Austin and from the Melbourne Genomics Health Alliance. So welcome to the team of experts. And any technical questions, Noelle's the one to answer those. So I'll speak for a few moments, then we'll hear from Professor Sutton and then Minister Pulford. Jala's got question time at 11:30, so we'll quickly get through our bit. Questions to Jala, then she'll run, and then Brett and I will be out here to answer any other questions. So in terms of the numbers, there are 51 active cases this morning, 0 new local cases, which is good news, another good step forward, and 2 cases of returned travellers. And in a moment, Professor Sutton will go through the outbreak here in Victoria and also comment on outbreaks elsewhere in the country. Today, I'm very pleased to announce the early results of our investment in a world-first genomics sequencing trial, stopping hospital superbugs in their track, preventing outbreaks and saving lives. So last November, the government invested $35 million in the Melbourne Genomics Health Alliance, and as part of that, supported the Controlling Superbugs clinical project. And this was a trial, multiple sites, multiple organisms, real time, and the outcome of that, and we're about to head to the next step, detected 600 more superbug transmissions than would have been identified using traditional methods. This is world-leading approach, world-leading technology. Genomic sequencing, as we all know, as we've come to understand, has been so critical in our fight against coronavirus, and as we're learning today, is absolutely critical in our fight against superbugs, particularly in a health setting. So I might now go to Professor Sutton to take us through the latest with the outbreaks, and we'll hear quickly from Jala, answer questions from Jala, and then we'll answer any other questions that you may have. Brett.
Thanks, Acting Premier. Good morning. So as the Acting Premier said, we had 0 new locally acquired cases this morning, which is terrific news, and 2 in hotel quarantine, 51 active cases in the state. Only 24 of them are local now. There were 13,176 Victorians who got tested yesterday. That's clearly come down from the very high numbers that we had in weeks previously, but the message is still the same. If you've got any symptoms at all, even the mildest of symptoms, please come forward and get tested. That'll allow us to find any possible virus that is still out there. I do want to thank the hundreds of thousands of Victorians over the past month who have set the standard for testing numbers across the country. We're really at fantastically high numbers on average, and it's been really informative for me in my decision making as Chief Health Officer to understand really that the high testing gives that high level of confidence around what the true situation is. As outbreaks stand, we're at 98% clearance of primary close contacts in the city of Whittlesea, Port Melbourne and the West Melbourne branches of the outbreak. They're stabilising, but we're not all clear yet, and a strong public health response continues, particularly in South Bank in the townhouses, and Jerome spoke about our work at that site yesterday. We're testing residents in the higher risk townhouses of the complex every 2 days, and one of yesterday's cases was one of those individuals who was in quarantine there. And we're doing a round of testing of residents in the lower risk townhouses, and those results should be through the course of today. From all reports, the Kings Park residents are genuinely committed to doing the right thing, working with our teams to protect the state as well as their households across those townhouses. And we thank them for really everything they're doing, setting aside their lives to keep us all safe, just as we thank the 10,000 others who've done the same as primary close contacts. We're also looking north, obviously, to Queensland and New South Wales situation, and we've been working with our counterparts in those 2 states to understand the risks associated with those outbreaks. We've got 7 declared LGAs in Sydney as orange zones. They're the City of Sydney, Waverley, Woollahra since the 11th of June, and Bayside, Canada Bay, Inner West and Randwick since midnight on the 20th of June. If you've been in these areas since the orange zones came into effect, then you need an orange zone permit to enter Victoria. That means isolating on arrival, getting tested and awaiting your negative result. And if you're coming here from Sydney on an orange permit to go to our alpine resorts, my first piece of advice is really you should be considering non-essential travel if you're coming from those orange zones. My second piece of advice is you shouldn't be isolating up on the mountain. Please isolate elsewhere and get your negative result before you head up. On vaccines, 15,339 Victorians vaccinated through our State Commission services yesterday. 6,391 received their first dose and 8,948 their second dose. I do want to put this call out to Victorians who received their first dose of Pfizer in recent weeks, and I tweeted about this yesterday, particularly those who are eligible in the expanded age to 40, but also those eligible because of the work classification that they're in. We thank you for your enthusiasm, we thank you for leading the way and for setting an example, but the job is not finished. We need you to do it one more time. That first dose of Pfizer provides good protection, 60-70% protection, but 2 doses finishes the job. It's 95+% protection from severe illness and death with that second dose of Pfizer, so it's critically important to get that follow-up dose. There are still tens of thousands of people who haven't come forward for their second dose yet. It can happen between that 3 and 6 week period after the first dose for Pfizer, so there's still time to book, and please do. Last week we had 50,000 people hit the 3-week mark for their second dose, and 30,000 people booked. This week we've got about 95,000 first dose Pfizer recipients who will be hitting that 3-week mark, and around 50,000 bookings in the system as of yesterday. So please book today if you haven't already. There's tens of thousands of slots left in the booking system, so please go to it. It's really straightforward, especially if you've had that first dose booked already, to complete the job and get that full protection from the vaccine. Thank you.
Thanks, Acting Premier and Chief Health Officer. Thanks also to the Austin and the Melbourne Genomics Alliance for the opportunity to join with you today, and particularly to Eddie Sara, who will be available to speak with media when we've all made a few comments and answered some questions. Eddie's story is very much why we're here today and why we're supporting the extraordinary new frontiers in genomics. Genomic sequencing is the new frontier in medical science. We've seen over the course of this pandemic what an exceptionally important tool it is for us to guide the public health response and to provide accurate and very detailed information. Genomics also has very, very significant benefit for so many people across the Victorian community. For anyone who experiences a terrible diagnosis or even a catastrophic diagnosis, or for their loved ones, I think what we all look for is hope that treatment and care will be the best it possibly can be, and certainty. What is this? What does it mean? What does it mean for the next steps and stages of my life, treatment and care? The Genomic Superbug project is one very exciting part of our work being undertaken through the Genomics Alliance. We're really pleased to provide in the budget $35 million, in addition to $25 million to start this project up a number of years ago. And the discovery that is being made here will provide protection to people from antibiotic resistant infection, and indeed will dramatically limit the spread of this type of infection, which of course is particularly dangerous for the most vulnerable patients in our health system. So people who've had transplants, people who have cancer, people who are in intensive care, these kinds of infections can have catastrophic outcomes. Researchers have so far detected more than 600 superbug infections that would not have otherwise been picked up. And I'd like to thank and congratulate our researchers for their discovery to date, but also the work that they're doing with people throughout our hospital system across Victoria to make sure that the workforce is trained to respond and deal with superbugs quickly and eliminate the risk and remove, where possible, the risk to patients. This is an important part, of course, as well to our work in managing this pandemic. Genomics, as we've all become so familiar, gives us insights into care and treatment and diagnosis, and that's obviously important for now, but important for patients who may already be suffering with difficult health challenges and those whose diagnosis might be just around the corner. Happy to answer any quick questions you have before I need to race back for an 11:30 question time.
Can we maybe ask the Professor just on the technicalities, if that's okay?
Yep.
On
Are you
how
all
it
good
works?
for me to go? Yes? Okay. I'll see you during the week.
Thank you.
Thanks, Charlotte.
Hi everyone.
Hello. Can you maybe walk us through how this actually works
Sure.
and what is being done?
Alright, so the project is the Controlling Superbugs project, and what happens is when a patient is in hospital and they have a sample taken, so it might be a blood sample or it might be a urine sample, something like that. So it goes to the laboratory, and our laboratories routinely look for superbugs and they can find them. But what we can't tell in the labs is whether these superbugs are actually related to each other. So is there spread of the superbugs within the hospitals? So being proactive, our hospitals are now looking to see with genomics whether we can identify outbreaks early before they really take off. So when only a few patients are affected, and that way we can put in very specific infection control interventions to prevent further spread and keep patients safe and hopefully save lives.
So does this mean that you take the genetics or you take swabs from every patient in the hospital?
So every swab that normally comes into the lab, so most of them we look for superbugs, and hospitals have programs where we actually screen specifically for superbugs. And using those samples, we take those and we sequence them. So we get the DNA fingerprint in the same way that we do for COVID to look where the bugs are being spread.
This might be a silly question, but when we're talking about
Okay, thank you.
when we're talking
So-
about superbugs, what sort of things are they? Things like staph or blood infections? What are superbugs?
So superbugs are antibiotic resistant bacteria. So they are they're bacteria that have become resistant to antibiotics. And over globally, this is a quiet pandemic that's been happening. We've all heard about the COVID pandemic, but actually the pandemic of antibiotic resistance has been going on for several years now, and it's going to affect. It's meant to cause 10 million lives by 2050. So some of them are staph. So MRSA is a particularly resistant staph. There are also resistant gram-negative bacteria. So these are bugs that live in our gut, and then they can cause things like wound infections, urine infections, and blood infections as well. And they can cause death as well as severe illness in our patients.
How many patients in hospital essentially get diagnosed with a superbug, or what kind of an outbreak are there in hospitals every year, and how many people die as a result?
So that's something that's a bit hard to answer, and one of the aims of the project is to look to do a snapshot across all of the hospitals in Victoria, so we can look for superbugs and where they're hiding, have an idea of how many people are actually affected. So getting a good idea of what those numbers are, I think, is part of the process of working out where we can target our interventions best.
And with these interventions, are early interventions crucial to being able to save people's lives?
Absolutely. So without genomics, with our routine lab methods, often we can't identify an outbreak until many patients are affected. So by using genomics, we're using it prospectively, so every time a superbug comes into the lab, we're going to sequence it and look for transmission or spread within the hospital. By identifying when there's only spread between 1 or 2 or 3 patients, then we can put in those early interventions before an outbreak really takes off. So that will preventing the number of people who become affected by these superbugs.
And what is treatment? I'm sure it varies across different infections, but is it like another super antibiotic or something?
So in most cases, we're actually detecting carriers of these superbugs or colonisation. So this is when people carry superbugs in their gut and they're not sick and they're not knowing that they don't know that they've got the superbug. But in that state, they can still spread the superbug through no fault of their own, of course, to other people. And it's identifying that silent spread that's really important. And this is where we can intervene, particularly with what we call infection control precautions. So isolation of the patients, so that, for example, you wear gloves and gowns, and that really limits the spread to other people. But also targeting some other interventions like very specific cleaning.
Thank you.
Were you happy with the discussions at National Cabinet yesterday, and are you satisfied with supply going forward?
It's a good question. Was I happy? Not really. It's a good thing that the ADF is taking control of the Commonwealth rollout of the vaccine, and they need to. Something needs to change. But am I happy? Not really. We do know for a period of time it's going to get worse in terms of the supply of the vaccine from the Commonwealth before it gets better. So there'll be weeks in July and August that we'll have a reduction in vaccine to our state sites, our mass vaccination hubs that have been meeting extraordinary demand over the last few months. There'll be a reduction in supply to the state sites for Victorians before it gets better. So there'll be a mad rush in October, November, December. But in the depths of winter, as we are absolutely striving to drive this outbreak into the ground, we're going to see a reduction in the vaccine. That's my assessment of the National Cabinet yesterday.
Is that the best answer that the Prime Minister could give you, that supply is just going to drop off and there's absolutely nothing that can be done to increase supply or get more vaccines?
Yeah, there was no update in terms of additional procurement, new supplies to fix this problem that we're going to have in July and August. So there's no joy in that space. There's that forward outlook, which is a good thing. We've got a sense at a high level what the rest of the year looks like, but there's certainly a reduction in supply for Victorians in July and in August. And you think about our nation had a sliding doors moment last July. Last July, there was an offer of Pfizer to the Commonwealth Government that would be enough for our country, and they didn't take it up. That was our nation's sliding door moment, and we're living with the outcome of that, the result of that decision right now, where only around 3% of our population is fully vaccinated. And you look to other jurisdictions around the world, 45, 50, 60% fully vaccinated, much higher percentage with at least one dose. We're doing the best that we can, and as Professor Sutton outlined, focusing on the second dose for Pfizer that is happening right now, and as much as we can, so delivering the second dose and then doing as much as we can for first doses. But we've got to balance what is a limited supply. We have got a limited supply right now. So we're going from a high of 95,000 first doses to around 40,000 in early July.
Given that you say we missed the sliding doors moment in July last year, in your opinion, do you think there's anything the federal government can practically do or should be doing to increase the supply? Or have we just completely missed that ship?
Well, as I said yesterday, the Commonwealth's rollout of the vaccine has been shambolic, and it was that missed opportunity, that big moment last July. But between then and now, 12 months, opportunities to procure more vaccines, to supply more vaccines to states and territories, and they haven't been able to do it. We are so far behind this race, it is not funny. And in terms of advice that we receive from public health, in terms of how we deal with the pandemic, how we deal with outbreaks, the fact that so little of our population is fully vaccinated is a problem. So that's why we've got to do the call out for testing numbers. You know, I'm a little bit worried about the testing numbers that came through yesterday. We need as a community to make sure that our testing numbers remain very, very high. So if you've got any symptoms, go and get tested. We've got restrictions in place to keep us safe. These are all the things we've got to do whilst we wait for enough supply of the vaccine to come through.
Premier, when are you going to be easing restrictions for Victorians again? Zero cases today, we've had a good run. People are still waiting and struggling with these restrictions. When are they going to be eased further?
So we're looking to make some further easing of restrictions later in the week, as we've done for the last few weeks. So every step of the way, further easing of restrictions for regional Victoria, the next step for Melbourne. I'm confident that we can do some further steps, that we can make some further steps, and we'll be announcing those shortly, but that's always subject to public health advice, what we can do and when we can do it. But I am confident that we can make some further changes this week.
New Zealand's reopened the bubble though, the Northern Territory's reopened, Tasmania's opened. We can travel there and be in large crowds there. What's the difference? Why not ease the restrictions today or tomorrow?
I'll hand over to the appropriate person to answer those questions, which is Professor Sutton, who leads our public health team. But what we've seen progressively, driving this outbreak into the ground, it's not over yet, but today is a good day. We've been able to have a period of lockdown and then come out of lockdown and then progressively make some announcements about easing restrictions. We'll make some further announcements later in the week, but I might ask Professor Sutton to make some comments as well.
Sorry, I have a question about vaccines. Do you mind if I just ask you quickly?
Sure.
Federal Health Minister Greg Hunt yesterday said in June, Victoria was going to receive about 407 vaccines, but in July, we're going to have about 560,000. So that's actually an increase in vaccines. Can you explain why we're sort of halving effectively the number of first dose Pfizer jabs that we'll be giving?
Well, the Commonwealth can desperately spin however they like. The reality is, in terms of allocations to our mass vaccination hubs that have been doing an enormous amount of work meeting the demand of Victorians, particularly in regards to Pfizer, the allocations to our mass vaccination hubs is going down. There will be weeks in July and August where we'll reduce to about 85,000 from 105,000. Now, they can spin it any way they like. The fact is, at our state sites, at our mass vaccination hubs for Victorians that have been doing so much work, there is a reduction in the Pfizer vaccines coming to those hubs.
Can I just to follow up on that then, are you essentially saying that the Commonwealth missed the sliding doors moment in July last year, and at the moment they're not doing enough or going above and beyond to procuring more Pfizer or more vaccine supplies from the global market?
Samaya, that is exactly what I'm saying. There was a sliding doors moment in July last year where there was enough Pfizer on offer to meet the needs of our nation. The Commonwealth declined to take up that offer, and then in the subsequent 12-month period, they have not done enough to procure supplies of vaccine and then deliver them to the states and territories. That is a fact, and you only need to look at our vaccination rates. You only need to look at the fact that only 3% of our population is fully vaccinated. You compare that to other nations around the world, we are so far behind in this race. Now, we're going to go down in July and August. We will do the best that we can, and our utilisation rate is very high. We get the vaccines, we put it into people's arms, but there'll be a mad rush, hopefully, at the end of the year. That's the best that we can hope for. In the meantime, we've all got to do our bit, follow the rules, get tested if you have any symptoms.
Can I ask you on that? Has the Prime Minister been able to explain why he missed the sliding door moment, why they didn't take up that offer? Did they think that we wouldn't need them?
There's no satisfactory answer that I've heard that's been discussed at National Cabinet. It's a question that should be put to the Commonwealth, but I'm clearly saying they missed our nation's opportunity in this pandemic in July last year, and they have not made up ground ever since. Only 3% of our population is fully vaccinated.
The last couple of weeks we've had a restrictions easing announcement on the Wednesday, so that's not going to happen tomorrow this week?
I'm not going to foreshadow. The public health team are working very hard. I'm confident that we'll be able to make some announcements for a further easing of restrictions. Victorians have done a wonderful job. We've just got to ask you to please come out and get tested. But I might hand over to Professor Sutton to make some comments.
Thanks, Acting Premier. Certainly on the question of other jurisdictions opening up to Victoria, yes, some have, some not yet, and some, require the testing or the quarantine of Victorians when moving, which is a reflection that the risk hasn't disappeared in Victoria, and that's true. We've still got hundreds of people who are quarantining. We've got scores of exposure sites who haven't gone through their 14-day period to be expired, if you like. And we've got lots of tests that we still need to come through today and tomorrow. So we're absolutely on the right track. I also have strong expectations that we can go that next step for both Metro Melbourne and regional Victoria, and that we'll do it this week.
Do you have any idea what that'll look like though? There's a NBL grand final on Friday, AFL this weekend. People will be wanting to go to those games. Is that a possibility you're looking at? Crowds?
It's a possibility, absolutely, and we're looking to do as much as we possibly can. And part of the, having these couple of days for that further assessment is to go as far as you possibly can in making those changes.
Can you understand people at home though that are saying, why wait till Thursday? Why not now? We've had, no cases in the community that weren't isolating. Why not today or tomorrow?
For all those reasons I've stated, there are still exposure sites where people may have been. We follow up very closely those tier 1 exposure sites where we try and track down everyone who's attended a restaurant or an indoor site where people have had face-to-face contact, and we're clearing those individuals and they're in quarantine. But there are those tier 2 sites where people have had briefer contact, many of whom have come forward for testing, many of whom have seen that call out, but some of whom may not have. And the challenge in Sydney is the same. They're not about to lift restrictions even though they've listed all those exposure sites, because there may still be people who haven't seen those listings or who haven't gotten tested yet or who aren't isolating. So we've got a lesser challenge in Melbourne, but it's not completely gone. You will remember the case from South Australia was quarantined and all of the close contacts were followed up, but it was about 2 weeks later that further cases emerged in the community. So we've got to bear that in mind. We've got to run everything down, and I still expect that we can make those changes this week.
What would football crowds look like if we did? We saw at the Geelong game on the weekend, they were sort of all bunched up and there was big parts of the stadium that had no one in it. Would we better manage that if we did do it this weekend in terms of spacing people out more? Yeah, I have gone back to the public health assessment panel to really embed that, to make sure that that's happening across stadia. The spacing that occurred within the zone in Geelong was still reasonable. People as groups separated appropriately, but if we're using a bigger capacity, I'd like to see those zones spread out more across the stadia.
In terms of this Thursday, Brett, is there anything that makes Thursday special? Are a certain number of sites coming offline, a certain number of tests expected to be done by then?
No magic numbers. We look at all of those things. Obviously, as the Acting Premier said, more people coming forward for testing just gives a greater level of confidence. Part of the issue about the original case in Wallert and then further cases popping up 2 weeks later was that there wasn't sufficient testing around that through that period. And so if we can get that high level of testing, we can have that greater level of confidence. I expect that we will clear the final cases in the City of Whittlesea and the Port Melbourne outbreaks in particular. The Arcare Maidstone outbreak is closed now. The Blue Cross site is stood down. Even the West Melbourne cases will get to clearance in the next couple of days. So lots and lots of positive moves, but no magic figure.
People who have weddings coming up this weekend, should they be tentatively cancelling those plans, or if they've got big crowds?
Look, it's very difficult for people to make plans when they haven't got those announcements yet. We will make them as soon as we possibly can. We will move as far as we possibly can. And so, for people who do have weddings scheduled and they've got those numbers locked in, I expect good news for them in as much as being able to go further from where we're at currently.
Australia has shown us that when we ease out of restrictions, regional Victoria takes a further step and Metro Melbourne follows in the footsteps of its regional big sister. Is that something that we can potentially look forward to on Thursday, or is there a possibility that you can potentially go even further? I know it's a possibility. You can't foreshadow. There's no crystal ball.
Got it. So yes, both regional Victoria will move, Metro Melbourne will move. There'll be less of a difference between them because they're moving more substantially. So there will probably still be differences. And you know, in the public events assessments, the assessment of a public event taking place way out in regional Victoria that's attended just by regional Victorians or overwhelmingly by regional Victorians will have a different risk assessment by the public events framework and the panel that assesses that. So there'll still be some differences, but there'll be less as time goes by.
Mentioned second doses, that you want people to come forward. Are you seeing people aren't booking in for their second doses and they're missing that time frame, or are you just concerned that they're not getting through to be able to book? What's happening there?
Yeah, I don't think people have missed the time frame yet, but I'm really keen to make sure they lock it in. So, you know, when people are coming up to their 3-week due date, if you like, for Pfizer, we want to see as many bookings as we had those first doses given out. We haven't seen that at the moment. It's about half of what we would expect. It may be that some people have other commitments or elsewhere and can't do it at the 3-week mark, and maybe they're going to do it at the 4-week mark. But we really would like as many people to book in. It gives us the assurance that those people are going to get that second dose, and we know how critically important it is to finish that course.
In terms of the crowds, the A-League Grand Final could be moved to Sydney if there's no announcement made today. Do you have any announcement in terms of crowds that's on the tip of your tongue, or any clarity given that we could lose another major sporting event if we don't make an announcement?
Yeah, I know fans are anxious for some announcements, whether it's footy fans, the A-League finals, the NBL finals. I'm really aware of that. I don't have anything to announce this morning.
Really?
No, really. But we are, through the public events panel, advice of public health, engagement, whether it's the A-League, the AFL, the NBL. We want to see crowds just like anyone else. We want to see crowds back as quickly as we can. We took the first important step in Geelong last Friday. I don't have anything to announce yet because that work hasn't concluded. But as I said, we are confident of having some further easing of restrictions, and there's the consideration of crowds through that public events panel.
But that could come too late. Is it going to be the case that Sydney sees this crowd and we don't?
No, we are. I'm not going to foreshadow that. We're keen to get crowds back in a COVID-safe way, based on public health advice. I'm aware of the finals, the various finals coming up, important games coming up, and we want to get crowds back, but we'll do it in a COVID-safe way.
Premier, a man in Melbourne hotel quarantine was denied an exemption by WA to be by his dying mother's side in Perth. He claims the Victorian Health Department told him he'd need to charter his own plane to WA if granted an exemption. Is that true?
Look, in terms of that specific question, I'm not aware. I'm aware of this. I'm aware of this case, and I firstly want to extend my sympathies to the individual, to their family. These are particularly tragic circumstances. In terms of where it's transitioning from one jurisdiction to another, there's obviously how do you travel, the quarantine arrangements, and the engagement with another jurisdiction, and that was not able to be done in terms of the response from the other jurisdiction. I'm aware of how personally difficult, how tragic this is, and it's a reflection of the times that we live in, and I'm really sorry that this was the outcome. But in terms of commercial flights, quarantine arrangements, they are really decisions that have been made in the jurisdiction at which that person wanted to go to.
How often do people get granted compassionate exemption to leave hotel quarantine in Melbourne? Has that ever happened?
I'm not aware of the details. There are there's an exemption team within public health that make those calls. Obviously and appropriately, they're not calls of myself or anyone in the government. These are calls that the exemption team makes within public health, and that's reflective of the arrangements in other health systems around the country.
James, a new poll out today shows overwhelming support for people who are fully vaccinated to be exempt from at least some restrictions in the event of a future outbreak. Is that something your government would consider in future?
ask me that question when we've got a decent amount of our population vaccinated. Like, you know, let's understand where our battle is and where the race is. The race is getting people vaccinated. When you've got only 3% of your population vaccinated, I can understand why people are saying that. But when you've only got 3% of your population vaccinated, now is not the time to be making those decisions or having those discussions. The only race in town is getting people vaccinated.
Pfizer issued a statement yesterday saying that claims that Pfizer met with the Australian government in July 2020 was incorrect. Have you seen that statement?
I have not seen that statement.
And how did you come to the conclusion that Pfizer met with the Australian government in July 2020?
I think that is common knowledge. I'm happy to come back to you, Samaya. There was definitely engagement between the Commonwealth and Pfizer. There was an opportunity in July to secure enough Pfizer for our nation. I'm not aware of that statement.
Both the Australian government and Pfizer have disputed that meeting taking place, though.
Well, the Australian government would dispute that because they have failed.
So has Pfizer.
They have failed miserably. They have failed miserably in securing enough vaccine for our nation. You only have to compare where we are as a country to other jurisdictions around the world.
It might be one for you, might be one for the Chief Health Officer. 10 new cases in New South Wales have been recorded today. Do you foresee changing our restrictions with New South Wales?
There's no change in advice as it stands. We obviously expanded the number of municipalities that are designated orange zones, but in terms of any further analysis, probably Professor Sutton.
That's the first I've heard. They'll obviously be discussed in detail at HPPC, and we'll get further information about the exact nature of those. We assess it every day. I'll assess it today as for any day.
Getting everyone who books their first dose in for their second dose at the same time to maybe alleviate some of those issues you were talking about. Why isn't that being done?
Sorry,
booking everyone who books their first dose and then book your second dose at the same time. Would that alleviate some of the issues you were talking about?
Yeah, look, I think that's happening now as much as possible. So people who book online will have that opportunity to book their second dose. The booking system hasn't been up for as long as some of those first doses have been given, especially for AstraZeneca, but that's all embedded in the system now, so that the prompts and the opportunity to have that second dose locked in are there now.
Just a question for the acting premier. Just before you go, Brett, just some questions on the iCook foods. Did you ever see a report from Knox that said the woman from Knox Hospital didn't eat from iCook foods?
Look, I can't comment, it's before the courts.
But do you think that the business was closed unfairly?
I can't comment, sorry. I'd love to, I would really love to, I can't, it's before the courts.
Just one more question. There's some allegations that you misled the parliamentary inquiry. Is that true?
Again, I can't comment.
No.
And can I just ask you, just before we step away as well, about Bondi? There's quite a few new cases there. Is that going to be considered a red zone at any point? Are you looking at that as a red zone?
Yeah, look, I'll have to review today, and if we need to make it a red zone, I understand the difficulties in those declarations, but if we have to do it to protect Victoria, I'll make the call.
Just a question for the Acting Premier. James Newbury dropped a bit of a bombshell about things going on at Parliament House. Do you think it's inappropriate? There's been a lot of commentary about this at Dawes this morning.
As I've said before, the behaviour was completely inappropriate and falls short of community expectations. That's why the matter was raised with the presiding officers as appropriate. But I've expressed my views before, and I do so again today.
The opposition says that your government's covered it up. What's your response to that?
Well, that is completely and utterly false. The matter was raised with the presiding officers, which is exactly where these matters should go. That's just a ridiculous statement.
Fiona Patten has admitted that she's done the same. We got a problem here?
Well, I think there's a broader issue around culture and behaviour, and there's a report. So this was a review that the presiding officers undertook. They've produced a report. The government's considering that in terms of what more we can do to improve workplace culture and behaviour within the Parliament. We'll respond to that report. We've received it, and I thank the presiding officers. No workplace is immune, and the Parliament is no different to anywhere else, and we expect appropriate behaviour in our workplace.
Can you discuss the findings of the Speaker's investigation into this incident?
No, not at this stage. So there was, sorry, in terms of the incident, or no, I can't. That will be a question for the presiding officers, as is appropriate. It was raised with the presiding officers in terms of the broader review of the workplace and how we can improve behaviour within the Parliament. The government's received the report from the presiding officers, and we will respond accordingly, and I'll have further to say at that point.
Are you considering involved apologise to you?
I've discussed this matter with him and expressed my view privately as I've done publicly. So I have had a discussion with him.
Do you think you should? Any sort of like sanctions involved? Like, will he be told not to come to work for a couple of weeks? Are you considering something like that?
No, these are matters appropriately with the presiding officers. That's why it was raised with them at the time. So it's not action that I would take. This is appropriately with the presiding officers of the Parliament.
Are you looking to legislate to prevent police accessing QR code data?
I don't think legislation is required. You know, we've got a really strict fence around this. QR codes, the data is encrypted. It is destroyed after 28 days. The only way that VicPol could get access to the data is via a court order. So just want to assure everyone that the privacy of this data is absolutely secure. It's encrypted, it's destroyed after 28 days. It's important to allow our contact tracers to chase down any outbreaks. It's just so important that people check in wherever they go.
Can I ask you about the business grants, the COVID ones? Have any of them been handed out? Do you know how many businesses have received them yet?
Yeah, look, I understand around 25,000 grants have been provided to businesses through the business support grants, part of the $500 million package. So I think around 113 million so far. There's tens of thousands more to go. There's been a lot of interest, a lot of applications, but I'm pleased that 25,000 have already been delivered to businesses to support them through this time.
And just with the tourism vouchers, some people are saying they're having issues redeeming them because of where the businesses' ABNs are located. So the ABN may be located in an area where that tourism grant doesn't apply. What can be done? Is there a kind of a review system, or is there anywhere that people can go to get that fixed?
Yeah, I haven't been briefed on that matter, but I'm very happy to come back to you. We want to sort those issues out as quickly as we can.
Particularly maternity services, the staff have been under considerable strain, particularly over the last year. Their surge casual workforce, they were essentially seconded to do COVID testing, and now they're doing COVID vaccines. So a lot of healthcare workers say that they're under incredible pressure to essentially be able to fill those fill shifts. Is there anything being done in that particular space to maybe have another surge workforce to do COVID vaccines or COVID testing, given we'll be ramping it up throughout this year?
Yeah, look, I know that so much has been asked of our health workforce over what has been the most difficult and extraordinary 18 months, and it has stretched us incredibly thin. We're asking a lot of people to assist, whether it's vaccines and testing. I know that we're trying to, and we have been, securing whether it's students, whether it's retired nurses, to assist in the testing and the vaccine program. I'm happy to further the Minister for Health to come back to you, Samaya.
Acting Premier, has there been a backlog in autopsies due to restrictions, lockdowns and things like that?
I haven't been briefed on that issue, but I'll come back to you on autopsies.
Acting Premier, did your government cover up that report or hide it while those investigations were going on?
I appreciate the question. These are matters before the court. It's simply not appropriate for me to make any comments.
On Thursday, the Corrections Minister announced a review into the culture of Victorians' prison system last week. What's the government doing to improve the workplace culture at prisons?
By doing just that, there's a review underway in terms of how we can improve the culture within our corrections system. And responding to other reports as well. So acknowledging that more needs to be done, and that's exactly why that review is underway.
Acting Premier, what are your plans for the mid-year break?
Yeah, spending a bit of time looking forward to it actually with Megan and the kids.
Cleaning up your backyard, maybe?
Yeah, that's right. A bit of cleaning up. So I'm counting down the days to the school holidays. Hoping to go to the footy. Hoping to go up north like a lot of Victorians to catch up with some friends, but that's going to be subject to how Sydney and Queensland respond to their respective outbreaks. So I'm like every other Victorian, looking forward to spending some more time during the holidays with my kids.
Great. Can't believe the alpacas didn't get a shout out.
The alpacas?
Yeah.
There's plenty of grass for the alpacas, they'll be fine. All right, thanks everyone.
Thank you.